Thank you for coming today. And before we start, I just wanted to ask you how you're feeling about having this conversation today. Uh, what prompted you to be a part of this podcast?
Anything to help, actually.
Ah, thank you.
Help anybody in any way I can.
And in this case, is in this scenario, you meant to say to help uh,
Help
increase
all
the.
those people that are coming through the system, through the cancer treatment.
I see. Excellent.
Mm,
Excellent. And let's get started with your story, right?
yeah,
And this all began a few years ago, right?
yeah,
When you went for a screening.
yeah.
So tell us a little bit more about your journey when it started from the beginning, from the
Right,
start of screening, and what
yeah.
happened afterwards.
July 2013, I went for a mammogram at
Mm-hmm.
the mobile unit in Newcastle. Uh, I then had to go into hospital for an operation. I got told, I think it was about 10 days later,
Mm-hmm.
I was in hospital at the time with clots from the operation. Dr. Narayanan came down to the ward
Mm-hmm.
and took me up to the cancer unit
I see.
of the ward. Told me I had breast cancer, told me it was 20 centimetre or thereabout, the size of a grape
I see.
at the time. I then went up to see Dr. Gihir,
I see.
who put, biopsy, took a biopsy. I was then back on the ward.
Mm-hmm.
I went home from that, and then I think it was taxis from the hospital for appointments
I
to
see.
come back in,
I see.
um, to have the marker put in. Um, then it was a matter of the chemotherapy. Blood test first,
Mm-hmm.
chemotherapy. The first lot of chemotherapy wasn't too bad.
I see.
It did knock me about a bit,
Mm-hmm.
but not much. You know
I
what I
see.
mean? I couldn't go to work because I worked as a cleaner at the hospital.
Mm-hmm.
I wasn't allowed in because,
I
of course, infections, viruses going around the hospital.
I see.
So they told me I couldn't go to work.
I see. And uh, Hazel, if I may,
Yeah,
uh, we will go and talk through your treatment, the journey of your treatment with this
yeah,
chemo and the surgery.
yeah.
But I think before we go there, let's talk about a bit more about the screening experience when you had the screening. And
Right.
you mentioned that you have had the screenings
Yes,
before
I
as
have had
well.
them
So,
before.
so you
Yeah,
would be probably a bit familiar with this.
yes,
So
yes.
tell us a little bit, take us through the process of screening, especially the initial one.
Right. At the mobile unit.
Hmm. Did you
Um,
receive a letter beforehand, or how were you
yes,
communicated?
yes, I received a letter
Hmm.
inviting me to come for a mammogram.
And if I may, uh, when we get these screening programs, invitations, some people prefer not to go, and due to any reasons, and obviously the majority would want to go.
Yeah,
What was your reasons not to go for it, or any particular reason that you wanted to go for it, and you
not
had?
really. It
Hmm.
was just something I had to do.
I see.
You know what I mean? I've got cancer in the family,
Hmm.
so I wanted to make sure that I was okay.
I see. Yeah, it's a sensible thing to do. And
Yeah,
there was a reason.
yeah,
If that's there on the offer, then why
yeah,
not? So you chose to go for it. You have
yes,
had pre-screenings, breast screening before,
yes,
which had come back as
okay,
okay,
yeah,
and but this one was different, right?
yeah,
And as you mentioned, right, then you were informed about the diagnosis, and then the subsequent steps took place.
mm,
But talking about the screening program in itself, when you went for it, how is the process? Or were you communicated okay? And is it difficult? What are the you know things you
yeah.
liked about it in terms of how it's been done, and anything which you probably would have wanted to be done differently?
I don't think there's anything I'd want to be done differently. They were very nice,
I
the
see. Good.
nurses, very pleasant.
Mm-hmm.
The screenings, as I say, I've had before, so I knew what was coming.
I see.
I hadn't felt any lump or any pain or anything, even during the screening.
I see. So you had no
I was like,
symptoms.
no, none whatsoever.
I see. Then having a diagnosis,
I know it
receiving a
was a shock.
diagnosis come as a, I can know.
It was a shock.
And looking back at the moment, who was it that disclosed you the bad news, and what was the thought process at the time?
What was,
When you were told that this is what has shown and
yeah.
this is what's going to happen next, were you called into the hospital to discuss the diagnosis?
No, because I was already in hospital
I see.
with the lung clots.
I see. I see.
The doctor came down
Mm-hmm.
and said, I've got some news for you. Well, my mum and my sister were visiting me at the time as well.
I
So
see.
the doctor said, is it okay to talk?
I see.
So I said, yeah, no problem. It's my mum and my sister.
Mm-hmm.
Doesn't matter. That saved me telling them as it happened. You do have breast cancer.
Uh-huh.
It's 20 centimetre, probably the size of a grape.
I see.
Um, okay. Have you got any questions? So I just asked, when's it coming out?
I see.
And that was it for that conversation.
Right. And you discussed with your sister and your mother at the time.
No,
She
I
kept
didn't
it.
want to talk about it.
And why is that?
I don't know. It's a funny sensation. I don't suppose I wanted to believe it, really.
I see.
So I just took the information in and locked it away.
I see.
My sister and my mum were asking me questions, which at the time I didn't have the answers to anyway, because I hadn't had any meetings with the doctors.
I see. Now, looking back at that, that time,
Yeah.
would you have probably done it differently in terms of sharing your story with your family?
No, I don't think I would. No.
I see. And the reason is because you wanted to, and it's perfectly
Yeah,
fine.
I just didn't want to believe it. It wasn't happening.
I see.
Do you know what I mean?
Mm-hmm.
So, yeah, took the information in and I just locked it away.
I see. And then the surgery took place and followed by the radiotherapy and chemo.
No. Because I was in hospital with clots, lung and leg.
I see.
We have to do your treatment different.
I see.
You have to have the chemo first,
Mm-hmm.
then the lumpectomy,
Mm-hmm.
and then the radiotherapy.
I see.
And I was on deltaparine, blood thinners, all the way through.
I see.
Yeah, I think I was on that for about 6 months. The deltaparine.
I can only imagine, having been already admitted with a blood clot.
Yeah.
And after that, coming up with the diagnosis of breast cancer and followed by the treatment, which included the surgery and the chemotherapy and radiotherapy.
Yeah.
It must have been
It
difficult.
was a lot. It was a lot to take in. I think that's why I shut it away, actually.
And apart from, was there any other mechanism you tried to cope with? The day-to-day life at that time wasn't easy, I suppose.
No, it wasn't.
So what was the things which worked for you or helped or supported you, and which were the things you probably would have wanted to do differently?
Yeah, I've always been a bit of a loader anyway.
Mm-hmm.
So being on my own during all this time just didn't worry me. I just focused on the treatment.
You were focused.
And getting better.
I see.
Do you know what I mean? So I think that was okay for me.
Excellent, excellent. And in terms of going to treatments, commuting to treatments, was anybody who was helping you with that, or were
No, I drove myself.
I see.
Yeah.
I see.
During the chemotherapy, my sister came with me.
I see.
And she sat with me while I went through the treatments.
I see.
But I drove.
And by now you have discussed the cancer diagnosis and the treatment options with your sister?
No, not with her. With the doctors, yes, but not with family.
When the family was helping you to drop to the hospital, were they not asking about what's going on?
Yeah. And when I didn't have the answers, well, I didn't want to know, to be honest.
I see.
So what I did was made an appointment with my key worker on the cancer ward.
I see.
And asked her for a meeting, which I took my mum and my sister to.
I see.
And I said to her, these two have got questions. Can you answer them, please? And I shut up the back reading a magazine
I see.
because I didn't want to know.
Did that help the gentleman who was helping in communicating? Obviously, when you are going through a difficult time in your life with the
Yeah.
as bigger problem as a cancer,
Mm.
and your family around you, they do worry as well, and they
Oh,
would
yeah, I
ask you
know they do.
questions.
I know they do.
The impact is on them as well.
Yes, it is. But I just couldn't. I couldn't deal with it. I
I see.
couldn't answer their questions.
I see. And in terms of the support system, I understand the family was there and there was limited communication.
Mm.
But did you wish to or wanted to speak to any other health providers like your GP or sought any
No,
counseling, or that wasn't a consideration
no,
at
it
the time?
wasn't even a consideration. I didn't want to
I see.
talk about it.
I see. And uh, so that's one thing. And about, you did mention, earlier I was talking to you when you mentioned about there was an impact, financial impact, and which come down to you.
Very big financial impact.
Do you want to talk about it a bit more for me before the
That I
audience?
think was harder
Mm-hmm.
than the cancer treatment, to be honest. See, thinking about it.
I'm sorry. Take your time. No rush. Mhm.
Thanks.
No, no.
I owned my own home. It was 2 bedroom, driveway on the front. It did me a treat. Lovely. But then when work finished me and I wasn't getting any wages coming in, there was just no way of staying where I was. As I say, if it hadn't have been for my mum borrowing money off her, I think I'd have been on the street
I'm sorry.
because I couldn't afford it. £86 a week I got, and that was it. Nothing else coming in.
It was difficult, isn't it?
Very difficult, very.
And you mentioned the work finished at the
Yeah,
time. Is it because of you couldn't, because of you were having
yeah,
treatment?
yeah.
Was there any conversations with your workplace because you were going through
I
the?
had to go in for meetings with them, yes, once a month.
Mm-hmm.
I think they just wanted to make sure I was going to be going back
Uh-huh.
after all the treatment had finished.
I
You
see.
know, I got paid a full month for the first month,
Mm-hmm.
and then I got half my wages the second month,
Mm-hmm.
but then it was just the £86 a week
I
from
see.
Dole.
I see. No, we're talking about, I think, 2013,
Yeah,
2014 when you had the
yeah,
treatment.
yeah.
It's almost going to be more than a decade now.
Oh, yeah.
And I believe a lot of support system has come since.
Oh, a lot.
And that
Yeah,
includes the Mac, right?
yeah,
The different charities,
yeah,
and as well as there are other pathways as well,
yeah.
where the patients are battling with the, the cancers or the treatment of
Mm,
the cancer,
mm,
they get the support, financial
yeah,
support from
yeah,
these different
yeah.
uh, charities or
Organisations, yes,
organizations,
they
which
do.
probably wasn't as
No, it
significant
wasn't.
at the
And I
time.
think because I owned my own home,
Hmm.
I couldn't get anything from the government. You know, the different, what do they call them now?
The univer-
The different payments they give you.
is it, is it universal credit?
Yeah,
Uh-huh.
yeah, that sort of thing.
I see.
I couldn't have
I see.
because I wasn't paying rent
Hmm.
or bills. Like if I was in rented accommodation, I could have got help.
I see.
But because I own my own home, no.
I see. So somebody who may be going through the treatment as of now, right?
Mm,
I think what we probably want to say that there are different portals available, right?
it's much
If
better
there's
now.
any financial issues,
Yes,
struggles with
yes,
finances because of those difficult times,
yeah,
then to look around, probably to ask the GP, to ask the community, other teams, or
yeah,
even the specialists.
yeah,
And there's a
yeah.
lot there,
There is a lot more now. I mean, you see Dougie Mac advertised on the telly now as well, don't you?
exactly.
That never happened when I was going through the treatment.
So there's more awareness now.
Definitely
I,
more help out there now. And reach out for it.
I see.
Reach out for
I'm
it.
glad. So the old journey began with a simple screening program,
Yeah, yeah,
and which detected it at a stage where it was early
yeah,
and got managed in a timely manner.
yeah,
And you did mention the journey treatment itself. You didn't find it as difficult. Am I correct?
That's right. The first, I mean, I had two lots of chemotherapy.
Mm-hmm.
The first one, 3 doses of.
Mm.
FEC, is it?
Yes, fac
FEC?
regime.
That's the one I had first,
Mm-hmm.
which wasn't too bad. It made me tired, feeling a bit weak,
I
but I
see.
was all right, you know. But that second one, that knocked me for six, the second one did.
I see.
Doxy something.
Yeah, I see. It's one
Yeah,
of the chemo.
yeah, a different chemo. That one was knocking me about terrible. I had sickness. I was suffering with constipation,
Mm-hmm.
very tired, lethargic
I see.
for a few days after I'd had the chemotherapy.
I see.
But once I'd got through them few days there and plenty of sleep, I
So,
was fine after that.
so Hazel, having sailed through the treatment, initially the news of the diagnosis of the cancer,
Mm,
and followed by the treatment that includes surgery, chemotherapy, and radiotherapy.
yeah.
And once the treatment was done, how long did it take to recover, or was it quite swift, or took it
The
longer?
surgery took a long time to recover from.
Mm-hmm.
They told me my arm would be painful for about 12 months, they said.
I
You
see.
know, it'll be stiff, your shoulder will be stiff.
I see.
But no, that lasted for about 2 years.
I see. So now looking back at from the start,
Mm,
and then the diagnosis, the treatment, uh, particularly uh, reflecting on the screening program.
mm,
Uh, what do you make out of the screening program? How helpful it was, and what would you suggest others?
well, it's a lifesaver, isn't it?
It is indeed.
If you've got something there and you don't go for that screening,
It's on you.
you could die,
I
you
see.
know, because then it gets too big for the hospital to cope with. It spreads. So I'm sorry, but you need to go for the screening.
I
It's
see.
very important to go for that screening.
Yes. And now, since you've been diagnosed, with this one, and the whole journey, has it changed your outlook towards your health? Obviously,
Mm.
you said the money was an important thing as well,
Oh,
and
it was.
so is the health, right?
Yeah,
Do you
yeah.
look at your health differently ever since?
Not so much health.
Mm.
Money,
Mm.
yes.
Mm-hmm.
I make sure now I've got backup.
Yeah. We mentioned about, right, the impact it has. The financial impact was a bigger,
It was big.
and
Yeah.
but had it not been the screening, it may have
Yeah.
been
Oh,
worse.
yeah. Yeah.
And what would you be, in terms of the the people who may be watching us at the moment, right?
Mm.
What would you advise to those people in regards to the screening, who may not be very sure about it, due to any reasons?
Yeah.
What would you advise be to those people?
Please go for it. Yes, it might be a bit uncomfortable when they're
Mm.
squashing your boobies in that machine. It is very uncomfortable. And I've heard from women who have bigger breasts
Mm-hmm.
that it's more painful for them.
Mm-hmm.
But that bit of pain could save your life.
True.
You need to go for the screening, girls. I'm sorry. You
Mm-hmm.
know, for that little bit of discomfort for a couple of seconds,
Mm-hmm.
it's well worth it. It could save your life.
I see.
Mm.
Thank you very much. And Hazel, on a final note,
Mm-hmm.
and you did mention earlier, you when you were diagnosed with it, you kept it to yourself. You
Yeah.
didn't discuss it with your mother or your
No.
sister. Now, from all the way from there, and now here having to come forward and sharing your story with all of us here,
Mm.
it needs courage, and it must have a purpose behind it, right?
Yes.
How does it feel? What does it mean to yourself to share your story with us, with all of
I
us here
I
today?
really, really hope it helps somebody who are feeling apprehensive about going for the mammogram.
Mm-hmm.
It's a couple of minutes, you know, of discomfort. But if you've got something there, they can find it. Even small, minute pieces, they can find it. And you need that found.
I
You need
see.
it found because it could save your life. Just think of your family. What are they going to do without you?
True.
You know, for a couple of minutes of discomfort, please go. You'd save me.
Thank you. Thank you very much. Really
That's all
appreciate
right.
that.
That's
Yeah,
okay.
that was.
I do hope it helps. I
I'm sure
really
it will.
do.
I'm sure there will be people out there, who
Mm,
would have listened to you and they will take note of it. And sometimes it's just that matter of that moment where,
yeah,
which clicks, and makes you think, wonder, and reflect,
yeah,
and do it. And
yeah,
I'm sure the moments like yours and the colleagues which came before yourself,
mm,
it will play a role. And I would hope that
yeah.
it makes a difference to
I
somebody's
I
life.
do hope it does. I really do.